Dr. Jeff Lehrman, podiatrist, certified coder, and consultant to APMA's Health Policy and Practice Department. This video is being filmed on April 1st. We got more changes from Medicare late on the evening of March 30. We still have the 4 non-face-to-face service types that we can provide for our patients throughout the COVID-19 public health emergency. They provided clarification for the first one, which in these videos we had been identifying as using our office E&M codes when those services are provided remotely. They changed that and they gave us more clarity on what they define telehealth to be. And Medicare is now very clear in that telehealth is when we provide a service remotely which ordinarily would be performed face-to-face. So that's that first option. In that March 30 announcement, they also expanded the service types that we can now provide remotely. Whereas before we were really focused on the office E&Ms, we now can also do initial and subsequent hospital E&Ms, initial and subsequent nursing home E&Ms, observation services, physical therapy. There's a whole list of them on the APMA website. We still have option number 2, which is G2012 for that virtual check-in for Medicare patients. We still have the telephone E&M and we still have the online digital E&M. Another change that we got from Medicare on March 30 was that we now can provide any of these 4 service types for both new and established patients. Another change that we got on March 30 is Medicare said they're going to start to pay for those telephone E&M services. And finally, big change that we got on March 30 was Medicare changed the guidance that they had previously provided in how they want us to bill for our telehealth services. So this again is using E&M codes that we ordinarily would use face-to-face, but now we can use when they are provided remotely. Prior to March 30, we were told no modifier in place of service O2. They changed that. Now, when we use that option, they want us to use modifier 95 and to use the place of service where that service would have been provided under normal circumstances. So for example, if it's an office E&M, place of service 11. If it's a nursing facility E&M, place of service 32. Those are the big changes that we got on March 30. The APMA website with all of this information is now updated and ready to go with all of the guidance that you need. And that website is apma.org/EM remote.